Hello and welcome to episode 73 of the Low Back Pain Podcast. I'm your host, Dr. Grant Elliott with RehabFix online low back program. And today's topic is your MRI is normal, but you have pain. So what do you do? What does that mean? This is a situation that many people, thousands of people find themselves in and is extremely frustrating. And we are here to explain why and what you could do with that information. If you missed last episode, we covered spondylolisthesis and how many people with this quote-unquote diagnosis are lied to all the time. And we dispelled a lot of myths behind this and how most people, what they're told exactly not to do is usually the solution to it, which is just hilarious. So I highly encourage you to go listen to spondylolisthesis episode 72 if you or anyone you know has received this diagnosis. Also, if you have not joined our private Facebook group, RehabFix Low Back Program, you need to do so because that is a way that you can connect one-on-one with me. We have a free sciatica guide on there that takes you step by step through our process and how we help individuals around the world fix their sciatica. We tell you our step-by-step process. We are telling you the secrets. So you need to go read that. Just by joining our page, you'll get tagged in it. We have other low back guides as well. So let's get into today's topic. Your MRI is normal. So many people with back pain, sciatica, any other array of symptoms related to the lower back will sometimes go get an MRI because they're looking for the answer. They're looking for the diagnosis, right? They're told by the healthcare system, you need a picture to know what's wrong. You need a picture. Well, a lot of people feel this way. I don't blame them. Okay, but it's what you were trained to think by the mainstream healthcare system, and it's not true. It's not supported by evidence. But besides that, you go to get an MRI, and they tell you, no, it's clean. Your MRI is normal. There's no disc herniation. There's no this. There's no that. Yeah, you're fine. You're fine. I can give you some pills, I guess, if you want. But you're fine. There's nothing to do. Go home. Yep, people are told that every single day. Every day. Yep, you're fine. Just go home, or we'll give you some pills if you want. But you're like, I definitely have back pain. I definitely have some fire going into my glute or going down my leg, or electricity going to my leg, or a ache creeping down my leg, numbness in my toes, whatever. I definitely have this. No, you're fine. Look at the MRI. You're totally fine. Right? That's what I talk about as the quackery of healthcare. Is judging people based on their MRIs solely and not actually assessing them or listening to them. That's healthcare quackery. So what do you do in a situation like that? Well, first off, you talk to somebody else. You go somewhere else. Anywhere else is probably going to be better than that. But this is extremely frustrating because you're not taken seriously. And once again, you are being judged based on the picture of you, not the discussion with you. They're completely dismissing everything that you said. They're dismissing all of it. They're just looking for a label to slap on you. Oh, they can't find a label on your MRI? Well, go home. You're of no importance to them. This is mainstream healthcare. Okay? So here's the important lesson here. Many, many times we talk about asymptomatic findings on MRIs, right? We know that 30% of individuals in their 20s will have a disc bulge on an MRI, but no pain. We know that 50% of individuals in their 40s will have a disc bulge on their MRI, but will have no symptoms. Degenerative disc disease, no symptoms. Spondylolisthesis, no symptoms. Common pain-free findings are all over, okay, on people's images. But what you don't hear a lot about is when it's flipped, when someone is in pain, but there's nothing on their MRI. This is extremely common too. So MRIs can show things that are not the problem, and they can also not show things that are the problem. So let me say that again. You take an MRI of someone's back. You could see a whole lot of things on that MRI that are not a problem at all. Or you could take an MRI of someone's lower back of their spine, and you could not see what the problem is. They obviously have a problem. They have all these disc herniation, sciatica symptoms, but you see nothing on there. You're not able to see the problem. But don't just rely on the imaging, okay? If the angle of it is slightly off or whatever, that could dismiss results. That could provide incorrect readings. But who cares? Like, it doesn't even matter. If you don't see something on their MRI, who cares? Talk to the person in front of you. Spend time with them. Assess them. Take them through a mechanical assessment. Check their ranges of motion. Do your disc test. Do your nerve tension tests. Do all these things to determine, oh, yep, obviously your symptomatology is that of a disc. Yeah, we put you down slumps test. You get increased sciatica down the leg. Yeah, obviously we have some nerve tension here. You're really limited bending forward. You feel like one leg is tighter than the other when you bend forward. The longer you sit, the more you feel it. Bending over first thing in the morning is tight. Really tight and stiff after sitting for a long time. You go to stand up, really tight coming up. Yep, these are really classic symptoms of people that we work with in our program all the time with classic disc and sciatic issues, ones that we resolve every single day. Like, this is common stuff. But if someone's just like, no, look, it's not on the picture, that means we don't do anything. That means we send you home. That means we just give you pills. Like, what? That's how you get lost in the healthcare system. That's how you spend a whole bunch of time and a whole bunch of money on things that aren't going to do anything for you. That's how you feel like you're written off and not treated as a person. That's how you feel like a number. And that's what we're here to stop. Okay? We need to stop relying on MRIs. We need to understand that MRIs can show things that are not the problem. They can also not show things that are the problem. What we care about is the person in front of us. We want to listen to the person in front of us. We want to assess the person in front of us. We want to ensure that we find the movements that are going to help their situation, reduce their sciatica, reduce their disc pain, improve their range of motion. Focus on finding those movements. Focus on finding the solution. Don't focus on finding a problem that you have to try to see to believe it or see it to prove it. That's such a waste of time. Focus on getting the person better. All right? We can do better as a healthcare system. We just got to encourage the right practices. And so I just want you to know that if you're listening to this and you've been in this similar situation, that we understand where you're coming from. And it can be really, really frustrating to feel like you're not being taken seriously. It'd be like you're just written off and you're just told either go home or take these pills and that's it. Like, that's really, really frustrating. So I just want you to know that you need to find a coach that will listen to you. Find a doctor, find a provider, find a therapist, find a coach. Obviously, we're an online program. We can meet with anyone around the world, and we hear these same things all the time, every week. We give people the time and attention they deserve. You'll get an hour with us just to go through this initial testing and make sure that we get results before you even join our program. Like, that's how much time we're going to give you and ensure your success. So find someone who's willing to actually listen to you. Find someone who's willing to treat you like a person. Find someone who isn't just trying to label you with some images so that you can actually get a plan for success that will guide you through the exercises that you need to do on a weekly basis with constant communication and constant attention from your coach or your provider so that you can get the results you're looking for and get that consistent feedback and know that you're improving every single week. This is what we're here to provide a solution for people so they can learn how to fix themselves and they know how to maintain these results for life and that they never need us again. That's the goal, right? So if you're looking for help with these type of issues and you're frustrated because your MRI doesn't say anything and you feel like you're in pain and you feel like you're not being taken seriously, let us know how we can help. Submit an application on our website. I'll link to that application in these show notes. Join our private Facebook group, RehabFix Low Back Program, so you can get more involved with our community and see people winning and see people achieving results and get more information about how to learn how to fix yourself and get on top of this and change your future. If you're finally done with this pain, enough is enough. Let's get this over with and let's get you back to living your life at 100% quality. If you are watching on YouTube, please like, comment, and subscribe. If you're listening on your favorite podcast platform, please leave a 5-star rating and review. It will help boost the podcast. We would greatly appreciate it. As always, move more, move in nature, move in the sun. Thank you so much for listening, and have a great day.